Abby is going to send you a survey, an evaluation survey, so please do complete that, because we want to make sure that whatever we're doing, we're improving and evaluating our own training as we go along. Okay, Antonia, can you move on, please? So, as I said, I'm Professor Andrea Wigfield. I work at Sheffield Hallam University. I'd say I've been researching loneliness for about 10 years specifically, and I've been involved in evaluations of different kinds of interventions and services for a whole range of different groups for around 30 years. So I like to think I've got a bit of an understanding of the topic, but I would say that we're always learning. Yeah, it's not necessarily as straightforward to carry out evaluations, especially of these kinds of services, as you might initially think. Antonia, do you want to introduce yourself?
Hi everyone, and thanks for joining today. My name is Antonia Ypsilanti. I'm an associate professor in psychology at Sheffield Hallam University, and I work with Andrea at the Centre for Loneliness Studies, and also co-direct the campaign to end loneliness. So very nice to be here today. My work around loneliness, again, it probably stems about 10 years now, and my main focus is the psychology of loneliness and its link to mental health issues. I'm particularly interested on chronic or harmful or persistent loneliness, so however you want to call it, and I'll touch upon that during the session today a little bit. I work across age groups, and in terms of evaluating interventions, I'm very much interested in measuring things in a quantitative way. So part of the discussion that we will have today will involve how we measure loneliness for interventions and what are the challenges. So really nice to be here, and I'll hand over to Andrea for now.
Right, great. So what I thought is before we launch into how to evaluate, I just wanted to talk a bit, just for a few minutes, about the research we do, because I think there's quite a lot of ways in which you as service providers or evaluators of services can link in with us in the future. So just firstly, to talk quickly about the Centre for Loneliness Studies. It's an interdisciplinary research centre which looks at loneliness across the life course, and we're slightly different from a lot of academic research centres in that all our research is led by policy and practice, and then we use the findings of our research to feed back into policy and practice. So we like to think that we're quite on the ground in terms of the research that we do, and linking theory to practical application. So our position on loneliness is that we are interested in the individual and their links with other individuals and social connections, but we're also, more importantly, I think, interested in the wider societal explanations for why people are lonely. So not just thinking about why they might not be able to connect with other people in the same way through life transition points like bereavement or becoming a carer or moving home, but also to look at the wider structural factors in society, the way in which housing is designed, the way in which services are provided, the way in which business and employment culture affects loneliness in the workplace. So we're really trying to look at loneliness in a holistic way like that. We're multidisciplinary, so we draw on academics and researchers from across a whole range of academic disciplines, ranging from health to psychology to sport to architecture. And we try and ensure that when we carry out our research, wherever possible, we involve the people who we're evaluating in the research process. So we try and co-create and co-design as much of our research and evaluation as we can by involving stakeholders, service providers, but also people with lived experience of loneliness. And as Antonia alluded to, we really approach loneliness research in a mixed methods way. So we've got experts on quantitative methods and measurement and using the loneliness scales, but also researchers who, like myself, approach it from a more qualitative way. So just briefly to say as well that since the beginning of May, the campaign to end loneliness moved over to Sheffield Hallam University as well. You'll probably all have heard that it was previously hosted by the What Works Wellbeing Centre, whose funding ran out, so the campaign didn't have a home, so it made sense for us to support the campaign going forward. So it's now based at Sheffield Hallam University with both Antonia and myself as directors. We do have a wide advisory group of stakeholders from around the country and people with lived experience of loneliness as well to help guide the work that we do. As you'll know, probably the campaign was set up in 2011 of a number of different charities and individuals who were keen to promote the loneliness agenda and to make sure that loneliness, especially amongst older people, it started off, reduces over time. And I think, you know, it's had quite a lot of success. Before Antonia and myself were really privileged to bring it to Sheffield Hallam. It was involved in supporting the First Minister for loneliness in the country and developing the subsequent loneliness strategy. And I think the way we're trying to use or sort of run the campaign is to ensure that we at Sheffield Hallam disseminate our research findings through the campaign so that we can make evidence-based decisions in terms of how we support in policy and practice. And just very briefly to finish in terms of the campaign, I've just listed that on the aims on there. So one of our aims is to ensure that research, not just the research we do, but the research that is carried out nationally and internationally, is used to inform policy and practice. But also we still retain that campaigning element. So we're keen to raise awareness about loneliness amongst individuals and organisations. And also influence politicians and policy through the work. We're hoping to continue the work with the all-party parliamentary group. And shortly we'll be hopefully having a portal on the Campaign to End Loneliness website where you'll be able to log interventions and your evaluation findings, and we're hoping to provide more support and training for that. And I think Antonia will mention something, a starting point of this at the end of the presentation or workshop, should I call it. Right, so that's sort of background to us and why we've come to set up this masterclass. So on here we've just listed what the key objectives are of the masterclass and what we hope by the end of this 90-minute session you'll come away with a better understanding of these things. So first, I think we want to discuss and raise the complexity of evaluating interventions on loneliness. As I started off by saying, I've spent many years, 30 years, carrying out evaluations, and I think there's always more learning to do, and subjects which are quite subjective, like loneliness, are always more difficult to evaluate. So hopefully by the end of this you'll see what the complexities are, but also have more knowledge about the way around those complexities. Secondly, we're hoping that you'll take away information that will be relevant and specific to your organisation and the types of loneliness services that you're delivering, and you'll have a better knowledge of, hopefully a better knowledge of how to evaluate those services and how to measure loneliness and which of the different types of measures are best suited for your service, whether it's the different scales, whether it's a new scale, or whether it's a more qualitative approach to measuring the service that you're providing. And finally, I think what we want to get across the message is that it's important to assess at the very beginning of any evaluations what your service is trying to change and how it's trying to change it, because that will help guide the type of evaluation tool you want to use for your service provision. So we weren't quite sure what knowledge participants here today at this masterclass would have, so we thought it was important to get everyone on a similar page in terms of some of the key terms that we'll be using as we're talking. So apologies to anybody who knows this already, and it's quite obvious, but I'll just run briefly through some of the key terms that we use in monitoring and evaluation. So I think to start with, it's important to recognise that there is a difference between monitoring a service and evaluating it. So monitoring data would often include collecting routine data about the number of people using the service, the length of time that they maybe use that service, or the types of people that are using it. So how diverse are the participants of the service, you know, looking at gender, age, ethnicity, etc. Evaluation data, on the other hand, is where we delve into more detail, collect more subjective and objective data that will enable us to make judgments about the quality of the services and projects that we're providing, but also what changes those services make over time. So do they increase well-being? Do they lead to a fall in loneliness? Do they lead to a fall in anxiety and depression, for example? And quite often, especially when we're looking at cost-effective evaluations, which we won't be talking about today, but you know, if you are thinking about how cost-effective is your service, you want to think about what the inputs are into the service that you're providing. So what kinds of resources, how much staffing, volunteer time, room hire, any other equipment that you need. And then the outputs. I think it's important to think of the outputs of the service or product as quite different from the outcomes, and sometimes people can get these mixed up. So the outputs are the service that you're providing. It could be a befriending service, it could be a training course, for example, whereas the outcomes are actually looking at the changes that service makes to people who are accessing it. So it could be a reduction in loneliness or maybe social isolation, for example. And then when we come to the kinds of data that we might seek to evaluate interventions, you'll all be aware that there's quantitative data and qualitative data. So quantitative data is around numbers, measuring the change in perhaps percentage terms, whereas qualitative data is really delving into more detail about people's views and perceptions, not just of the service, but of the change in their everyday experience, in this case of loneliness. And quite often in evaluation terminology, we talk about indicators, and indicators are really measurements to show what those outcome changes are. So quite often in loneliness, you'll have heard about the UCLA loneliness scale and the de Jong-Geveld loneliness scale, which Antonia will talk about a bit later. And then finally, in terms of some of these key terms, it's important to ensure that the data that we get is reliable. So it needs to be consistent and trustworthy. So, for example, if we use a UCLA scale, we would expect an individual's response to that to be the same or similar if they were asked it over a constant period of time without any other interventions taking place. And validity is really around ensuring that the data measures exactly what it claims to measure. So, for example, sometimes there's a confusion between loneliness and social isolation, and we need to ensure that any scales or indicators that we're using are measuring the right thing. So if we want to have a reduction in loneliness as a result of our service, we need to make sure that we use a measure that an indicator that measures a change in loneliness as opposed to a change in social isolation. So before I move on to the next slide, just has anyone got any questions about those key terms? Is everything clear there? Because I think Antonia will be using quite a few of them later. Okay, no hands going up, no questions in the chat, I'm assuming, but okay. Hi,
there is one hand up.
Yeah, Belinda.
I just wanted to clarify what your views are on the difference between social isolation and loneliness. That would be really helpful.
Yeah, of course. So in my eyes, social isolation is an objective count of the number of contacts a person might have over a specific period of time, whereas loneliness is a more qualitative, subjective feeling, usually seen as an unpleasant feeling that people have when they have a mismatch between the social relationships that they would like and those that they have, and quite often compared to their peers as well. Does that make sense, Belinda?
Yeah, that's great. Thank you very much.
Okay, thank you. Any more questions before we move on to the next slide? No, okay. Okay, so just thought it's worth reminding ourselves why we evaluate. So there are a number of reasons, and there are probably many more than I've put on here, but just a few. So one is for learning and development, really to understand what the service we're providing is, what the implications are for people, and also for accountability. So quite often we might be accountable to a board or to shareholders, but certainly if we're investing resource into providing a service, we ought to be evaluating it to ensure that it's doing what we set out to do. And quite often, funders are the driving force of evaluations. They want to ensure that anything that they fund, any service they provide, is providing value for money. But I think there are some other important reasons to evaluate beyond those kind of accountability and financial reasons as well. So, for example, we know that if staff and volunteers hear that their service and their work is having a positive effect on people's lives, then that can really help in terms of their motivation and their confidence as well. And it can actually help, them develop as individuals within the organisation. And I think finally, it's really important to evaluate to avoid spending time and money on activities which may not actually be doing what we think they're doing. And sometimes services are well received by participants, but they may not always have the desired effect that they set out to achieve. So I think there's some of the reasons why it's important to evaluate. Antonia. Okay, I think just want to say as well that we know from evidence that many more organisations are evaluating the services than ever before. We've discovered that 3/4, so 74% of charities say they're investing more in evaluating and measuring impact. Quite often that is a result of changing funders' requirements over the last 20 years or so, where anything that's funded really requires some kind of evaluation. But I think it's also important to recognise beyond those funder requirements that actually the main benefits and reasons for evaluating services ought to be that we want to make sure that the services we're providing do benefit the individuals in the way that we want them to. Sometimes you'll get surprising benefits as well that you weren't expecting, and that is also an added bonus, really. And then what do we want to find out when we evaluate? So as you set up a service, and often you're applying for funding for that service, you'll be thinking about what are we trying to achieve? What are the outputs and outcomes that we say to our funders that we want to achieve? So it's important to evaluate so we can look at those. But I think, not just to demonstrate that we've achieved those, but if we aren't achieving them, why aren't we achieving them? What can we learn from that? What parts of the service or the activity have worked well, and maybe what hasn't worked so well. And often if we evaluate along the way rather than just at the end, we can change the services according to those evaluations. So I know the Ageing Better programme that ran around the country, we tried to reduce isolation and loneliness, which was funded by the lottery a few years ago, really focused on encouraging service providers to do what I think we called a sort of test and learn. So learning from what services you provided, but not to worry too much if they didn't go well, and to evaluate along the way so you can tweak those services so they improve over time. And I think that's a really important sort of lesson to learn, that you don't wait till the end to evaluate along the way, and you can make tweaks to the service then to ensure that it's doing what you set out to do. And then another reason, another thing you want to maybe find out from an evaluation is, are you reaching the people that you want to reach? So, for example, quite often loneliness services don't always reach the most lonely people, and sometimes they reach people who are already accessing services. So, it's important to think about who are you trying to reach, and which groups are you trying to reach, and does the service reach those people? And then finally, I think it's important, one of the other things you might want to find out is, what do the service users think about the service? So there's, on the one hand, is looking at if the outcomes are met. So does loneliness fall? Does well-being improve, for example? But sometimes it's just important to find out what service users think of it. Is it being offered at the right time of the day? Is it being offered in the right venue? Can people easily access it? Do they feel comfortable in the venue that the service is being provided, for example? So, there are a whole range of reasons why you might want to evaluate, and different types of questions you will want to ask depending on your service and the kind of organisation that you are. So I'm going to stop there, and Antonia is going to talk about in more detail now about evaluation frameworks. But just before we move on again, any questions about that kind of background to why we evaluate? Okay, great. So Antonia, off you go.
Thank you, Andrea. Okay, so I'm going to start by making things a bit more complicated than Andrea has already made them. And then gradually, as we move through the slides, you'll see that we will try to tackle each of these components separately and trying to provide answers to your questions. But I think part of this masterclass was also involved engaging you and your experiences. So we'll be a bit more interactive as we go on and try to get your feedback. So we said that we are going to develop a framework. And the first obvious question is, what is a framework, and why do we need a framework? Because following everything that Andrea said, we have a lot of questions that are still unanswered. We have a lot of options. And this is where we need the framework. So a framework would be something that you would design that would be specific to your organization and the type of interventions that you want to evaluate. So that's why the framework is important. So I'm going to kind of walk you through an example of a framework, and then we can kind of build that together with your input as well. So there are 5 steps, general steps in evaluating a framework. So you will probably know most of these steps, but it's good to kind of put them in a perspective where you can reflect on what it is that you're doing, what is the target population, and precisely where these frameworks are coming from. So the first step is to define and measure loneliness. So what scale do I use? That's the first question that you'd need to ask. And as Andrea said, it might not be a scale, it might be a qualitative measure of the change that you're making. The second question is, what is my target population and what is the context? So we would be looking at specific demographic groups, but you could also look at combining demographic groups. However, when you combine the demographic groups and characteristics, your evaluation framework will become a bit more complex. And I'll explain later in an example what that means. So what is the design of the intervention or the service that we are delivering? Now, in psychology, we use the word, and as Andrea pointed out, we use the word intervention a lot, as if we're constantly intervening. What we are trying to say is that there is something that happens that we are delivering, a service or something, that changes something else. That's the key kind of component of the intervention, as we call it. But you can call it service or whatever it is. And we need to look at what type of intervention you're delivering, what is the mode of delivery. For example, it could be an online befriending service or a face-to-face. It could be a group activity and so on. And what is the duration of that delivery? And I'll walk through these parts in a bit more detail in a moment. Andrea touched upon outcome measures in the glossary as well. So what is there's never going to be one outcome measure. Most likely you will have several outcome measures. So you will be changing several things with whatever it is that you're delivering. So you need to kind of think about what is the primary outcome and what is the secondary outcomes that you're changing. And I'll give you a few examples in a moment. And then one component of the evaluation framework is scalability, which we're not going to talk a lot about today because this is more about developing what you currently have, but it's something to think about when you're trying to scale up. So if you're doing a small pilot study, so you're delivering a small service to a small number of people, but your aim in the future for your organization is to scale that and deliver a bit more of that because you find it successful, then you need to think about the required resources. Can it be replicated into different populations or in different cities or in different networks and so on? So that's something to consider. Now, where is this all coming from? It's all coming from how reviews are being set up. So when somebody writes a review about evaluating an intervention, and I'll show you examples in a moment, what they always want to see is clarity in 4 things. What is your population? So who are you targeting? What is the intervention or the service that you're delivering? Is there a comparison group? And what are the outcome measures? So exactly what I've been saying to you just up until now, but in a more consistent way, is what reviewers would want. And this is called PICO. PICO under Cochrane Reviews, which is a very big library of interventions that is being reviewed and evaluated. So PICO stands for population, intervention, comparison, and outcomes. So it's basically identifying the components that we've been talking about. So let me take an example, and that might give you a little bit more understanding. So let's say we want to evaluate a virtual peer support group intervention or service for older adults living in rural areas to reduce social isolation. Now, if I were to go back to what I mentioned before, that PICO, within this example, we can clearly see the population that we are targeting. This is older adults living in rural areas. Okay, we clearly see the intervention. It's a virtual peer support group that we are trying to create or deliver. And the outcome measure is to reduce social isolation, for example. It could be, as Andrea said, to reduce loneliness. It depends what the outcome measure is. Now, what you don't have here is C in PICO, which is the comparison group. And often it might be the case that you don't have a comparison group. And that is okay, as we will talk about a bit later, because sometimes it's not possible to have that comparison group. So there are ways to still maintain robustness in your evaluations, even if you don't have a direct comparison group. You win some and you lose some, but we can talk about this a little bit further down. Is this example relatively clear, and what kind of the components of the framework will look like? If you do have any questions, you can put them in the chat, and Andrea will stop me, and we can talk about it. So hopefully we can start building a framework, okay? And there are, as I said, there are 5 components to this framework. It's exactly what I've talked about before. The middle square is scalability, that we said, we're not going to be talking too much about it, but it's something to consider, especially if you're in the early stages of starting to evaluate the service that you're doing, and in the future, you want to scale up. So the first thing on the top left corner of this framework is measurement. Don't worry about it for now. Yes, there are the UCLA loneliness scales. There is a direct question. There is an ONS. There are qualitative ways that you can measure, but there is a measurement issue overall. Then we're talking about the population, and this is where the example was relating to, so older people or younger people or any age group. You don't have to limit yourself. And then we need to be a bit specific about describing what is the service delivering. For example, it's a weekly 1-hour virtual peer support group that is facilitated by a trained therapist or a volunteer, and it lasts for 12 weeks, or it lasts for 2 weeks, or it's an ongoing process. And then what you're looking at for the outcome measures is probably some primary measures, like we said, maybe loneliness, maybe social isolation, but it might be that you have secondary outcomes that you want to look at. For example, you can collect some measures on mental well-being, on quality of life, on ease of interaction even. So what is the actual platform and how you use it? Because it's a virtual platform, you might want to know about whether people find it easy to use. So all of that is part of your evaluation. It's not only about whether this intervention is changing loneliness or isolation, but it's also any feedback that you get from participants on how they found the platform they used, what was the quality of the interactions, and so on. And these will all be primary or secondary measures. Now, if when we're starting to build a framework like this, then we're starting to ask questions like, is there a comparison group, like we said? And what are the benefits of having a comparison group? So just to touch a little bit upon that, if you do have a comparison group, we are talking about a group that doesn't receive the service that you're delivering or something else, and they are most likely going to be on a waiting list. So if you have that opportunity, it might be good to have a comparison group, but it's not always as easy as that. The next component of the framework has to do with what are we changing, and we'll come back to this over and over again throughout this masterclass today. We are using the UCLA or direct question or whatever it is that we have picked. Have we ever thought of whether these are designed to measure change? And remember that, as Andrea said, we might not be only evaluating, we might be monitoring change, which means that we might need to use these measures multiple times. So we might say, okay, we're starting this virtual peer support group, which lasts for 12 weeks, and we want to look at the loneliness levels or the isolation levels of people joining the group. And then we want to see after 2 weeks, is there any improvement? And then after 6 weeks again. And then at the end of the 12 weeks again. So are these measures designed to measure change across time, or are they measures of just loneliness at one point? So that's something else that we need to consider. And then let's say that we complete the intervention. What happens after 6 months? Are the effects that we have found long lasting? Or is this something that we're interested in? We don't have to answer all of these questions, but it's just to start building that framework. And within the framework that you built for your individual circumstances, you have to think about these questions. You have to think about these things. And this is why I said at the beginning that a framework is very much dependent on what you want to do and what is the service that you are providing to people. So I'm going to show you, and one of the premises that I forgot to mention, and I think, Andrea, we haven't talked about this quite a lot, is that we have certain premises at the campaign and the Center for Loneliness Studies. And one of the key premises is that we try to use existing evidence. And we always advise people, if there is evidence that something works, you should definitely see what is it that works and how it works, because that will give you a bit more information about what you want to do. It might take a little bit of time, and in the past it has been quite challenging to find existing interventions and how they work and how they're measured and so on. But fortunately, quite recently in 2023, the WHO developed what they call evidence gap maps. And these are really useful tools for anyone that wishes to develop a framework, or anyone that wants to start thinking about delivering a service, or anyone that wants to see how they can evaluate that service. And I'm going to walk you through a little bit each of these gap maps. And as we said at the beginning, you will be able to access the slides, so you will have access to these maps. So if you can see on my screen, and hopefully you can see my screen now. Andrea, is that okay? Yeah, people can see it, right? Okay, good, thank you. So this is the wonderful WHO map that was created by academics like ourselves, actually very good colleagues that we work with. From the key person that developed this was from Canada, and it's a world map. So what you can see as I hover over these nice little circles here is you can actually, and this is open access to anyone, so it's really useful to have a look and spend some time on this map. On the top horizontal axis, the top line up here, you can see the word outcomes. And this is one of the words that was in the glossary earlier. So what are we measuring? So it could be that you want to measure loneliness, isolation, social connections, and you can see all of these secondary perhaps outcomes that you can include in your evaluation. So you might be changing quality of life or well-being as well. You might be changing mental health symptoms like anxiety and depression, self-esteem, health services use, anything that you would like to change. You can have a look at this horizontal axis at the top here. And then on the left-hand side, on my left-hand side, you'll see if I scroll down, there are different types of interventions currently that have been delivered. So if you look at the types of interventions, the first one is self-delivery. We don't have many of those, as you can see. So self-guiding interventions are only 6 that tackle loneliness. Then there's self-guided social skills training. Again, there are only 5. But if you scroll down and if you look at how big some of these circles become, that means that there is more evidence there. Okay, and the more evidence there is for something, the more you can use for your own evaluations. So let's go down to some of the community-based deliveries, for example. There are interventions that tap on group activities and use arts or gardening or physical activity. And if you click on that, the purple, and I insist on clicking on the purple because they are considered the most robust. If you see yellow ones are low quality reviews, so they're not very good studies. So if you would like to look at the highest quality, you just simply click on this and it will bring out all of the studies that have done interventions, community-based interventions that are delivered by communities in group activities, and you can click on each of these and read the key characteristics. So, for example, social participation interventions for people with mental health problems. This is an example of a study. You can also see the mark on next to the study. So if it's a purple, it's quite high quality. Other colors mean that they are less robust, but nonetheless, they might be useful for you. And you see a total of 122 records, studies, just on community-based deliveries. And as you move further down, you can see other types of deliveries. And obviously, as you can see, the most common ones are group activities, social support groups as well, and also social skill training. So these are all to reduce loneliness. And as you move along, you can have other types of interventions that reduce social isolation and so on. So this is a really good resource as a starting point to think about what it is that you're changing. Now, if we go back to the original slide, the second link here, it talks about a similar evidence gap map, but with digital interventions this time. So I'm going to show you a similar example. So if you look at this map and you see very little purple ones, that means that they're not as robust, they're not as high quality reviews, but still you can learn a lot from these. And these are interventions that are digitally delivered, improving social skills, enhancing social interactions, and so on. And I think you get the basic idea. So the reason why I'm sharing this is because I feel that it's really important to not have research waste or not have not take into account what are the existing good practices in the field of loneliness interventions. So you can get a lot of ideas about how you will do your own intervention evaluation. So if we go back to our framework, like we said before, so now you're more, if you kind of go there and you find that this is similar to something that I'm delivering, then you can kind of understand a bit more about measurement, populations, outcomes, and how interventions are delivered. Okay, so the question now is, how do we evaluate? And before I start going into more detail, does anybody want to make any comments or have any questions so far about the framework and the two resources that we shared? Okay, so then I will continue on how do we evaluate. Okay, so we're going to start by talking a little bit about measuring loneliness, and I'm going to start talking about quantitative measures of loneliness, and I'm going to just give you a few examples of some of these measures and what concerns have been addressed in using them. And it's not to say that these measures do not work. It's just to say that we should be careful which one we pick and for what reasons. So there are pros and cons in everything. Okay, so the two main scales that are used most often to measure loneliness in interventions is the UCLA and the Dijon scale. Now, there are various versions of the UCLA, as you might know. The most frequently used version is the 3-item UCLA scale, and the reason for that is because it's very short and very quick. It does have good validity and reliability, but obviously there are a few issues with that scale, and I'll come back to that in a minute. Then there are a series of youth loneliness scales and children loneliness scales that you can pick to use, depending on if that's your target population. And if that's the case, then you can obviously follow up in a discussion later today as well, but also email us later if you're interested. And there are various single direct questions. And I'm going to make a really quick note here about the single direct question scales. They usually ask, how lonely are you? Okay. And there have been concerns with single item scales. Usually studies that are using single item scales with multi-item measures have found a lower prevalence of loneliness when using single item scales. And there is quite a lot of evidence on that. The other concern that sometimes comes to mind is that when you're asking someone, and the reason why, well, the two are interlinked in a way. So when you're asking someone, how lonely are you? They might be a bit reluctant in responding positively that they are very lonely, just because there is a lot of stereotype against reporting loneliness. And even in cases where these are anonymous questionnaires, people tend to be a bit defensive about how they express their loneliness scale. So therefore, it has been found that they're a little less reliable than multi-item scales. Understandably, people want to make the shortest scale most readily available to people that are participating in the services, because that means that they don't have to burden them with long questionnaires and so on. So as I said, there are pros and cons, but just consider that this might not show the extent of loneliness as you expect it to, just because of this one item selection scale. Okay, so there are different scales, but the Office for National Statistics currently suggests the following measures. A 3-item UCLA loneliness scale, this is what they are using, and plus a 4th item, which is a direct measure of loneliness that says, how often do you feel lonely? Now, if you see on the right-hand side, my right-hand side, the response categories are on a level of frequency. So how often do you feel something? And the more often somebody reports feeling lacking companionship or feeling left out or being isolated from others, that is an indicator of higher loneliness levels. Now, there have been norms, and people suggest that over a cutoff point in this scale. So, for example, the scores in a single item question range from 3 to 5. And the higher the scale, the higher the scores, like when you reach 6 to 9, people are considered to be lonely. But I need to draw a little bit of caution on that. This is not detrimental. It's quite a random description and selection. So from a psychometric perspective, and working with a lot of colleagues on the revision of these scales, there is no real evidence that says that someone scoring 6 is lonely, someone that scores 5 is not. So what we are trying to determine a little bit more is the experience of loneliness itself as well, in a more qualitative way. And Andrea will touch upon that in a few moments. So, what are the challenges to using these measures? And I would like you now to pause for a moment and think about, what do you think are the challenges to using these measures? And when I say these measures, I am referring to challenges that might involve a single direct question that you have used in the past and you found some challenges, a longer version, a UCLA scale, or the De Jong scale. So if you have any experience of using any of these measures that were described, can you please just add to the chat what you think are the challenges to using them? And there is a question from Corina. How many people do we need to have in a sample to make it valid? That's a good question, Corina. So the sample size, we'll come back to that in a moment. But the sample size doesn't necessarily determine the validity of a scale. The validity of a scale is mostly dependent on how it was developed. So the sample size is just there to be used. But validity means that the people that designed this questionnaire, or these questions, they have been informed by people with loneliness. They have been informed by interviews. They have been informed by various stakeholders on what is linguistically appropriate and how to use something. So it's not about the number of people. It's about how the development of the scale was done initially. I don't know if that answers your question. I think, so is anybody, right, okay. Let's see a few of these. Okay, so Carol Green, we've avoided those measures, preferring the campaign to end loneliness measurement tool. It's short and uses positive language. Thank you, Carol. That's really great. Frontline practitioners feedback, they feel awkward to ask questions about loneliness, even though they recognize their clients do experience loneliness. So a challenge in the language, right? I've used the De Jong and it made people very sad. Yeah, I can totally understand that. It's a subjective assessment and everyone may have different opinion on the frequency. Yeah, very good point, Lucy. So when you're asking someone how often, what does that refer to? Does that refer to how often in my life? How often in the past 6 months? How often in general? So we're kind of taking a snapshot of a perception or an interpretation of a question. And, you know, it will vary how people respond to that. Right, so there is an element of error in that. I work with care home residents, that's from Jenny, some living with dementia. It's hard to measure, but we use care home staff. However, this is their perspective, not necessarily the truth. Okay, thank you very much, Jenny. Yeah, there is a bit of difficulty there, I would say, on how you use these scales in special populations. It might be people with dementia. It can also be other populations that are less able to respond to these scales. Quite recently, we had a big discussion about how some of the measures that we use, especially with very old adults, like over the age of 75, can they reflect or understand these scales? But I would say more widely, if I go back to the questions that we looked at, how often do you feel that you lack companionship? I don't know how I would respond to that. Companionship, what does that mean? How often do I feel left out? I can perceive that as a little bit of a social rejection item. And how often do you feel isolated from others? I would ask there, emotionally isolated or socially isolated as well. Okay, so it is quite tricky, and I think there is a lot of evidence currently that shows that these scales might not be the best ones to use. So we are supporting various arts projects to help us consider different ways and methods to use using creative approaches. Yeah, very, very good, Jill. That's really good. And stigma around loneliness can vary in different communities depending on your background. That's certainly the case, Lucy. And the questions have been around for ages and are standardized. The UCLA has a number of items which are just weird. Is there a limited scale emerging that addresses different aspects of loneliness that can be used to get a nuanced? Okay, so I will give you a couple of examples, and I'll also put in the chat one specific paper or an article that reviews the most commonly used measures for loneliness. And it's very clear. And if you avoid reading all the psychometric language, then you will get a sense that many of these measures are not always measuring loneliness. So some of the questions are not addressing loneliness. And Christian mentions the different aspects of loneliness. So there is a very wide distinction, widely used distinction. We don't know whether that is quite the case between emotional loneliness and social loneliness. And and there is also existential loneliness. So there are different types of loneliness that have been constructed as different definitions by the literature. And often what you might find is that these differences overlap a lot in these questionnaires. So I'm going to put in the chat a link to an open access paper review that was written by our colleagues in the Netherlands. And anyone who is interested more about this can have a read. So the paper is called How Not to Measure Loneliness. Okay, and it's a review of the 8 most commonly used scales. So I think that might be useful because yes, you read that, Christian, didn't you? Yeah. So it's quite useful because each one of you will have different ideas of what you want to use, what populations you have. So I think it's a good idea to look at this paper if you haven't done so, and think about there's never going to be the best measure, but you might want to think about which one is more appropriate for your evaluation. Okay, so I've just summarized a few of the challenges that you've also mentioned in the chat. So loneliness is subjective and difficult to measure by its nature. It's complex and cannot be always understood through a quantitative measure. Loneliness varies, like you've said, rightfully. People often move in and out of feelings of loneliness in a typical week. So what does it mean? How often? There is stigma that many of you have mentioned in the chat. So people don't want to admit to being lonely. There is some evidence from our own research that indicates that many interviewees do not understand some of the questions, like you pointed out as well in the chat. So older people and BME groups might not be able to understand the questions on the De Jong or the UCLA scale. For example, like I said, companionship and things like left out have different meanings in different cultures, and that can be a challenge. And there has been some incompatibility between UCLA score, De Jong scores, and other qualitative responses by the same individual. So, for example, someone might respond with the UCLA and be marked as feeling lonely or not lonely. And then in a qualitative interview, what they are mostly referring to is being socially isolated. So they have limited number of network or contacts. And then just to round off the discussion about measuring things and measuring loneliness, you might want to consider other things, the wider implications of reducing loneliness that might come into play, like I said before. So you might be measuring quality of life, motivation to participate in activities, or self-efficacy. So I'm now more able to talk to others, depending on what other things you are reducing with your interventions. Okay, Andrea, can I just ask you to just briefly talk about the qualitative measures that you might want to use?
Yeah, thanks, Antonia. I think it's really interesting to look at the comments on the measurement scale, the loneliness scales as well, because I've spent the last 10 years or so discussing this with colleagues and other people, and it is quite tricky. On the one hand, they're really good because you've got consistent data and you've got comparable data with other population groups, and you can, it's used widely across the world. But at the same time, there are serious concerns about whether those measures measure what we want them to, and people's interpretation of the questions, as well as reluctance to ask and answer the questions. So what we've tended to do is use the loneliness scales as a baseline, but at the same time, wherever possible, use more qualitative approaches to understanding people's experiences as well. Because I think in that way you can really delve into more detail about people's everyday lived experiences, and not just a snapshot of one particular time when they decide to tick a box. So there are a number of ways you can get that more qualitative information about participants who are using your services or interventions. So we've just listed a few on here. Interviews are the most obvious one. Usually semi-structured interviews, so you design some questions which are open-ended and enable you to have a discussion with the participant about the service and about their levels of loneliness, and when they experience loneliness, how that maybe changes over time. And quite often it's good to do those interviews over a period of time. So you might, for example, carry out an interview at very early stages as someone comes onto the programme, and then towards the end to see how their experience might have changed over the course of the intervention or service. Now, a few years ago, we did a bit of an experiment to talk to individuals who said they were lonely on the UCLA scale, and then at the same time we asked them more detailed questions about their loneliness. And it was interesting that sometimes, yes, on the UCLA scale it showed that they were lonely, and when we interviewed them in depth they also appeared to be lonely from the conversations we had. But on other occasions people either said they weren't lonely on the UCLA scale, but when we interviewed them it was clear that they were lonely, or vice versa, that on the UCLA scale they weren't lonely and were lonely, but weren't when we actually spoke to them. It was obvious that they weren't lonely as they were talking. So I think it's clear that by carrying out more mixed methods research you can really get into detail about people's experiences, and it also enables you to get that journey of the participant as well throughout, from the beginning to the end. You can get some nice quotes and examples of how the service maybe has changed their lives in a slightly different way than you can just by having a measurement of a percentage fall on the UCLA scale. If you haven't got a lot of resource to carry out many interviews in that way, you can run focus groups. Now, you'll probably all be aware that focus groups, it's a group of people, usually between 6 and 8 is the best number to get in a focus group, who have got something in common. So they have to have something in common for it to be a focus group. That could be that they're a user of a service, or it might be that they're all of a particular age, so all maybe young adults or all older people. But the key thing about a focus group is gets people together who've got something in common. So you've got that common point of contact, and then you have a discussion around a topic guide, which you have usually between 8 and 10 questions maximum. And you can use focus groups to really have a good discussion of the participants of your service or intervention, to discuss how that's affected them, what changes they've seen in their everyday life, any changes they might want to see in the way in which the service is being provided. And quite often focus groups enable you to delve in more detail in a way that individual interviews don't always allow, because quite often you'll get different viewpoints in a focus group. Sometimes you'll even get sort of semi-arguments, but where people have a different point of view, and that can then promote a discussion amongst the participants, and it can bring out information that you wouldn't necessarily get through interviews, and certainly you wouldn't get it through looking at the loneliness scales. So focus groups are it takes a little bit of time to recruit participants to them, but if you can connect it to an activity or a service that you're already providing, provide a bit of lunch or some refreshments, usually you can quite easily get a group of people there. And it's quite a cheap way of carrying out qualitative research, but really getting into detailed information from the participants. Another tool that you can use is to ask the participants of your service to keep a diary of how they're feeling throughout their involvement in the programme, and you can use then the diary extracts to enable you to assess and evaluate the impact of the service on them and their levels of loneliness. And then there are all sorts of other kind of pictorial, diagrammatic ways of assessing loneliness, which I think are quite interesting, and it's sometimes a bit less scary for participants as well than if they're told that you want to interview them. I think they're sometimes more likely to do things that involve art-based activities, and sociograms are a good way of doing that. So for those of you who don't know, a sociogram is kind of some concentric circles, and on the circle you place yourself in the middle. So you would draw a circle, put your name in the middle, and then you would place the names of anybody who have any social relationships around that circle. The closer to you on the circle that the names are placed, the closer the relationship is, the more meaningful that relationship is. The further away, then the more distant that relationship is. So it might just be that somebody that you happen to say hello to in the morning, for example, but you don't really have any meaningful relationships with that person. And sociograms are a good way of mapping change over time. So again, you could ask the participants of your service to plot their social relationships on a sociogram at the beginning of their engagement in the service, and then further maybe around the middle and towards the end, just to look at the extent to which your service might have brought people together. It might have brought new contacts, so new names come onto the circle as they go out through the programme. And quite often towards the end, those names become closer to the person as well, if it's a really effective service, because it will be enabling people to make those contacts and connect after the service. So let's say you have a yoga class once a week, which is designed to get people together. If the service is really effective in terms of reducing loneliness, those people then start connecting beyond the yoga class after on other occasions, and that will enable you to it will be then more likely that on the sociogram the names become closer to your name on the circle. So there's a whole series of papers and articles on sociograms. If anyone wants any information on any of those, like interviews, focus groups, using diaries or sociograms, if you let us know, we can send those links. We also do run training sessions on all of these as well. So again, just let us know if you want any more information about that. But I certainly think from our experience, it's good to have a mixed approach to measuring loneliness, and not to assume that any one of these approaches is going to necessarily provide the full answer.
Thank you, Andrea. So
any questions before we move on to yours, Antonia, on the qualitative side? No. Okay.
So you can put things in the chat as we go on. Okay, so just a couple of more points before we kind of break into breakout rooms, just to have a little bit more concrete discussion about your specific interventions. So we talked a little bit about a comparison group, and as I said before, it's not always the case that you can have one. So these are the different types of comparison groups that you might have. Some of them are randomized control trials. You may have heard of these in your readings, or non-randomized control trials or feasibility studies. So as we move from left to right, feasibility studies are the least robust, but the easier to deliver and require less resources. Randomized control trials are quite expensive, and non-randomized control trials sit somewhere in the middle, both in terms of robustness, but also in terms of resources. So it's quite important to consider these, but also be realistic about what you can actually deliver, and not be put off by the fact that you can't run an RCT. It doesn't mean that you can't do anything. So study duration, I was just going to tap on this. And if there is anyone in this room, in this virtual room, that does deliver interventions, can you just quickly put in the chat what's the length of the intervention that you're delivering? If anyone is delivering anything at the moment as we speak. If not, it's okay. I'm just going to give a minute. 12 weeks or forever. Okay. So Karina, Belinda, is that sort of befriending services that you're delivering, which are mostly like when somebody signs up, they stay? Barry's several. Okay. Running social outgroups. Very good. Okay. Brilliant. So just pointing out, when do we expect to see a change? That's something quite interesting to discuss and to reflect on, because loneliness doesn't change from one day to the next. And we have to think of loneliness as something that goes up and down, and it changes across the life. And you might feel lonely on one occasion and then kind of go from feeling lonely to feeling less lonely, and so on. So when would we expect to see a change? What I'm trying to just highlight here is we can't expect to see a change in loneliness or isolation or any of the indicators straight away. We need to allow time. But it seems from your feedback that there is a lot of variability to that. So how long does this change last for? If you are delivering the services infinitely, then it will last for as long as you're delivering the services. But it's something to think about as well. So how long is that for? So we have a small group activity. We have about 20 minutes, but I would like only to spend about 9 minutes on this, if that's possible. Andrea, do you want to kind of explain a little bit what we will be doing, and I'll start to allocate people into breakout rooms.
Yeah, so we're just going to split into, I think, 2 rooms, I'm assuming, Antonia. If you can take a screenshot, if you're able to, of this, it'd be really helpful, because I think we're not able to see it when we go into the breakout rooms. So what we want you to do is have a think about what intervention you might be running already, or you might be considering to run in the future, and just think about what it is you're trying to actually change with that intervention. What is your primary aim? What outcome are you looking for? And then alongside that, also have a think and discuss what you think that the users, the participants of the service, feel that they're changing by participating in the intervention, because those 2 things might be the same, but they might not actually be the same as well. And then if we've got time as well, just to think about how you actually know what you are changing as part of that process. Are you carrying out evaluations to do that? Is it the information that participants are telling you anecdotally, or are you carrying out some comprehensive evaluations in the way that we've been talking about? Now, there are no right or wrong answers to any of these. It's really just to get us discussing the kinds of evaluations and interventions that you're involved in. So I think we've got around 10 minutes, haven't we, Antonia?
Yes, we have. I'm going to ask you to join the groups, 10 minutes maximum. It looks like we're all back, or almost all back. I know it's quite challenging to bring everybody back after we've left. Oh, amazing. A lot of people are coming back. Great. Very nice to see people joining again.
We were just in the middle of an interesting discussion then.
Oh, yes, I know. Sorry. It kind of pulls you back, doesn't it? Okay, so we are getting a few people to rejoin. And I think we are towards the end, so we'll give people a little bit of an overview of the top tips. I think we would go now, and then finish with a few things that we want to share with everyone. So let me just share my screen again. Okay. So, and we're still recording, so just so everybody knows. So I just wanted to provide a few tips for evaluating interventions. We had a lovely discussion in the breakout rooms. We were by accident, we were a group of people working with arts as interventions, so very interesting. So these are just a few of the things that we wanted to, like, as take-home messages. Nothing is perfect, but what can you do? I mean, there's nothing that will create the best possible solution for you. If you would like to do a quantitative measure, select a standardized one, and that should be supported, like Andrea said, by qualitative data, because the mixed methods approach is the best. Develop a framework, which is basically a plot of what you, or a plan of what you want to do. Consider a comparison group if possible, and utilize existing resources like the ones I showed you from WHO to get some ideas. Keep it short, because that will help participants not to feel overwhelmed. I would also add to that the language that you use, yes, it can be positive, but also just talking about loneliness should be a very natural way, or just reducing the stigma around discussions on loneliness. That would be a really good aspect to your framework. So focus, you can't evaluate everything. Consult experts if you need to. That will save you probably a lot of time and money. And as I mentioned in the breakout rooms, co-create with users. So consider the users in that evaluation framework and think about what they think, what their thoughts are about what's changing. And if you consider volunteers, users, service deliverers as a package within your framework, that will give you a much better understanding of what it is that you're evaluating and what it is that you're changing. We do have a link here. You can scan this with your phones, or you can use this Google form here. If you are interested in evaluating interventions that you are delivering to tackle loneliness, and if your organization would like to evaluate it in using external or internal funding, you can click on this QR code, or just click on this Google form, add your name, your organization. It's only like a couple of questions, and we can get back to you and get in touch and see if we can help you either receive funding or arrange funding possibilities, or just discuss evaluation protocols and anything that you would like in this field. These are our emails, and myself and Andrea are always ready to answer any questions. And I'm just going to leave it at that, because we have 3 minutes. And Andrea, if you want to say a couple of words before we close.
I just want to say thank you ever so much for joining. And we didn't, our discussion in our room was cut short, so we didn't actually get very far on the discussion, but I think certainly this is a good starting point for anyone wanting to carry out evaluations. And I think we realise it's quite a quick summary of a lot of complex information, so we will send the slides over, and there's links to further reading. But if you do have any questions or you want any more detailed discussion on any aspects of this, we're very happy to do another session through the hub on any elements that people are interested in. So just get in touch with us and let us know. And I think Abba, who I think is still on the line, will be sending an evaluation form of this session, just so we know how to pitch things in the future, what might be improved, etc., and what you might have learned. So thank you very much for attending, and any questions, we're still around. Jenny?
Do we get a copy of the slides?
Yes, we'll be sending those out. Yeah.
Perfect. Thank you.
We can get and the links are all live on the slide, so you can use them if you want to.
Marvellous, thank you.
Yeah. Any other questions? I mean, we'll stay around for a few minutes. Book has arrived at Waterstones.
Thank you, everyone.